Hey, we're back, folks. I'm your host, BKP, and it's time for Ask the Doc with Dr. William Whaley and Dr. Raymond Tidman. And we want to thank North Georgia Cancer Research, affiliated with Northside Hospital, for this segment. Every week since March, we have done an update, and there's always something to talk about and something you want to know. So there's so much to cover. I'm excited.
Now, wait a minute now. I started just the last week in January, when I
Yes.
said, there's a flu epidemic in Wuhan, so we were ahead of the curve, always ahead of the curve.
I agree. No, I agree with that.
Okay.
We brought it into full circle. It was early
March.
in the year,
Yeah,
and we had changed direction as far as we call this Ask the Doc because we would do questions, and we do questions about diabetes and so many different things and cancer, but we switched to this. But we have encouraging news today. What do you think? Hey, if you're seeing something online and you're seeing the possibility for tickets to go see a concert, is it okay now? There's questions like that. Have you been to the grocery store recently? Not naming any, but if they have an open salad bar's back, open. There's some things that feel normal now. So we have all those things. Why, out of this eye, do I see you up to something?
I need to interrupt you. Will you stand up for a minute? Come on.
Oh my gosh. Emily, do you know what's going on?
I do.
I need a hug. Give me a hug, buddy.
Okay.
Thank you.
Okay, so now that you've been, this is now considered a super spreader event.
Well, the other thing is I want to congratulate Dianne Feinstein for, the two senators that are deadly mad at each other, and she gave Lindsey Graham a hug yesterday, and now they want her hide. So, good on her.
What sense does that make?
So I got
they want her fired.
All right, okay.
They want her fired.
So she hugged Lindsey?
Because she hugged Lindsey.
All right, now we haven't gotten into the tie.
Okay, you stay over there.
All right, now. First of all, he invited you up here on the first segment and told you to bring your money and that the apples are in and all of that. It's a 0 chance of rain in the next 3 days up here. Zero, essentially zero, okay? 48 degrees on the porch this morning while I have the coat, and now I'm doing a Tidman with these socks here and this fancy tie. Both of these were given to me by a grateful couple for sort of helping them through the thing here. And I always wear a tie. This is the first new tie I have had in probably 5 or 6 years. My kids didn't like my ties, and 5 or 6 years ago they just cleaned out Neiman Marcus with ties, and I've got a new tie and a new pair of Tidman type socks. So anyway, that's what I got. Oh, and we're still 18 inches up in rain in the mountains. Okay.
When we're talking about encouraging, and I want to stay with that. I like what you just said with 3 days, come and enjoy the outdoors. And this is Ask the Doc, but this is right down the vein of some encouraging news we have. Our orchards up here, we're apple capital we're going to call it the world. We're going large like anybody would. But U-Pick is back. Now they're some of the orchards have started the U-Pick where you can bring your family up and go through and do the U-Pick. That has not been happening. They had to stop that.
Well, I think they're outdoors. It's going to be a beautiful day.
Now, is this the first weekend of leaf looking?
No, we're not ready for that yet.
Okay.
It is in North Carolina, but not here yet. But anyway,
and Vermont.
Oh yeah, I'm talking about around here. So anyway, let's get
encouraging
news. Okay, here's the thing we've been talking about in the last few weeks. So I'm going to get into the testing of this rapidly availing test in a few minutes, and I want to put some real science in it and the cautions that are needed. I've spent actually 4 or 5 hours in the last 3 days with an expert in the testing business first, one CDC official that I happen to know, and then one epidemiologist at a well-known Southern university about this testing. But here's what I want to say about the encouraging stuff first. Anybody who has been following this has been looking at these New York Times maps, and so I'll just pull that map up there. This map has historically shown in the world of the countries that have the highest attack rate, and we've already been able to find the United States on the top group of 9. It had not been off the top 9 since March. Well, I'm going to say they're down about 25 pages here. I'd say this is down somewhere around number 80 or something. Now, some of these countries above it I've never heard of before, but Angola, but you look in there in France and Spain and all the rest of those countries are in there. So here's my first encouraging piece of information. The press has been chewing President Trump up. He should have done what France did. He should have done what Sweden did. He should have done what somebody else did. Europe has just beaten us 10-1 over the COVID virus. So now for the last 2 weeks, Europe has had 152 cases per 1 million people per day. Now, the populations are different, right? So if they say Europe's got 78,000 cases a day and the U.S. has got 49,000 cases a day, that sounds like we got about half. Well, Europe's got more population. So if you break it down to, Europe has had 152 cases per 1 million population routinely now for the last several weeks. The United States has had 150 per million for the last couple of weeks. Not a whole lot of difference, but that shows that Europe hasn't cleaned our clock. They're worse than us at this exact moment in time. So I think that is an extremely positive fact. Now the next one was, show it, if you take that USA map and you look at the last 3 weeks, at the number of cases per day, yesterday was the 15th, right? 16th? Anyway, on the 15th,
yesterday was the 15th, yes.
There were 406,000 new positive tests in the United States. For reasons that we've discussed before, people are calling those cases. I don't like calling them cases. But that number is up 16% over that period prior. Deaths were 6,000 per day. That's down about 10%. So what we've been saying here for the longest kind of time is when you get tied up in this case number, which is positive test number, that's not the hospitalization number. That's not the death number. It's not the number of people who are getting terribly ill. Later on, we'll come back to whenever you get ready, to the fact that they were asking the president's doctor last weekend. It was about 6 or 7 days into his course, and he was out of the hospital already and standing on the porch. Is he going to relapse? And so we've got some recent concern about the relapse and the fact that you can go out 10 or 12 days, leave the hospital, be better, and then crash like an airplane. But that's not germane to where we are right now. So I'll get out of it now and go back.
But let me take it to this, because we have so many positive things happening here because of treatment and what we know and how to treat the virus now, and the direction we're going in with vaccines and clinical trials. But let me ask this, and you guys handle this, because if we're out here, and I always put myself with our audience out here, and we're watching on a daily basis, let me tell you what we've heard this week. We've heard flu season's coming, all right? We've heard, and I'll give you a whole list of things, and then you guys can just go. We've heard flu season's coming. We've heard round 2 is coming with COVID, okay? Round 2 is coming. We see networks put up maps that say these states have had a increase in infection rates in the last week, and we've even gone as far as I'm not going to say whether they took it out of context, but now they're saying maybe we should rethink our Thanksgiving meals and gathering as family All of that's out there. So wave 2 of this virus, let me give you the points. Wave 2, where are we at? What's our concern? What's our concern going into winter with the flu season? What's our concern with family gatherings and some of the things? You follow where I'm going?
All right, here you
That's
go.
what we're hearing.
Okay.
You guys address that.
Here are 2 of the 3 top articles in science literature this week. The first one was the Europe passes U.S. Second one, COVID-19 does not seem to be a seasonal event, meaning we're not going to expect that it didn't go away in the summer and that it's not going to be seasonal because the environmental factors that affect flu being seasonal are somewhat different. And then the next one, now this is really important. Read that, the big headline. Small household gatherings are driving the COVID-19 increase. So here's the epidemiologic study. They show a teenager who infected 24 people that had a negative test. And that's why I want to get back to this rapid testing. That where people are getting the biggest numbers of cases, not the ones that make it to the news, like the announcement of the Supreme Court selection, is in family gatherings, and not in restaurants, and not in bars, and not in
not
grocery stores, and not outside. So what is generally happening is you've got people who the big one the last few weeks was high holidays for the Jewish people.
Right.
High holidays for the Jewish people. I mean, this is 5,000 years or 4,000 years of tradition. It's 5,000 years. They're in 5,800 or something now of tradition where families gather and they celebrate the Passover, or they celebrate the New Year, or they celebrate these various things. And the high holidays are called the high holidays because this is it. This is the big deal in the Jewish community. So in these Orthodox communities, particularly in New York, where the families have 100 people in them instead of 12 or 8 or something, there were a significant number of cases. I know that our epidemiologist family, they had high holidays, but they had them socially appropriately separated. They had young people come in there, young meaning 50. And I think that when you're talking about doing this holiday season, many people are going to think that if they can get this rapid test the people and they're negative, they can go into the nursing home, for example. They can't do that because that test that the Abbott man says is 97% sensitive and 95% specific, when tested by Cleveland Clinic and by New York University, had 40% false negatives to 15% false negatives. The test says specifically in its licensing, it's only to be used in the first few days of a single case study of people who are symptomatic. That's where there's going to be a lot of virus that's going to be symptomatic. So I believe you do have to rethink the way you're going to be doing your holiday. Not that you don't have the holiday, but that you are careful about it. And if you've got an 85-year-old grandmother in there, and then you're bringing a few kids home from college, grandmother is going to have to be protected in that house. Now, Ray, do you agree with that or no?
No, I agree with it. And it comes back to the big wrangling that's going on in our industry right now. The Barrington petition basically came out and said that the social isolation and the shutdown of the economies has doubled the world's poverty rates. Doubled them. Poverty kills. Okay, so basically they're saying shutting down industry and knocking down jobs is more deadly than the virus. So what do we do about that? What we do about that is what we've been saying on this program all along. You protect those people that are at risk. And other people say, well, that's impossible. You can't lock up all the elders and you can't just put them away and all that. No, but you can teach all the elders how to think like a hospital worker. We teach our hospital workers how to not get the virus. and how not to spread the virus. So you focus your energies on helping those. First of all, am I at risk? You know, it's not just age. We had a tragic case, or have a tragic case ongoing in this community of a young, robust man in his 50s, a little bit overweight, that, you know, is really, you know, hanging on right now. So it's you know, are you overweight? Are you diabetic? Do you have other lung diseases? Are you immune compromised? Those things. But just don't listen to me. Check with your doctor. Are you at risk? And if you are at risk, then when you need to do these gatherings, be extra careful. Learn how to protect your air, how to not stay in dead air with other people, how to do things outside when you want to do them. But for heaven's sakes, you know, have your family events and love on your grandchildren as you can, carefully. You know, but that's the thing, is that it's on those adults who are quite capable and have lived a long time to learn how to protect themselves. And that's really where it's at now.
The fear, and I say the fear that is gripping people from the media. I'm looking for somewhere to put it, but it's just candid. The media that is creating a fear that people are living in. I noticed somebody posted on social media and a picture of them opening a box and inserting their mail-in ballot, and they posted and said, "I voted safely today."
It's so crazy, Brian. Let me interrupt. Bill, if you have if I send you a patient with cancer, do you spend any time at all trying to make them afraid?
No.
None. I mean,
None.
you do the opposite, right?
No, I
You
sit
say,
down and say
this
no.
is this. Tell,
Right.
Emotionally, how do you handle it? The first thing you're doing is trying to say, we're going to overcome this.
Yeah, first thing I do is I sit down.
Here's where we're at.
Here's what
we gotta go.
I do first of all. I think this is important because my approach is different than 98% of oncologists.
Somehow that doesn't shock me.
I take the record. And I put it over here, and I say, I treat a human being and not a record, and I want to know all there is to know about you before we talk about this. So by the time I get through knowing about their history, their educational history, what they do for fun, what kind of occupation they had, what their family was like, where were they raised, particularly what do you do for fun, I've got a value system I understand. I've got sort of an ethical system I understand. And then I say, look, here is what you have. Here are the options, but you're a human being. The recommendation and the standard of care is this. The options are that, and which way do you want to go? I'm an ex-Marine.
Right.
If you want to kick ass and take names, which is my personality, here's what I would recommend doing for you. And then patients usually leave the office very encouraged when they came in there thinking I was getting ready to tell them to go out and find a plot of ground and make a will. So
I want to say something
we're
right there.
not trying to frighten people. We're trying to encourage
I have
them.
to say something there.
Go ahead.
A friend of mine, no longer with us, went to Dr. Whaley, cancer, several years back. Former Marine. He calls me up after he gets done and he says, "You know, I like that guy." He said, "I like that guy." He said, "I didn't know if I was there to get treated for cancer or we were going to take the hill. I didn't know which was coming first." He said, "I like that good old Mariah."
Well, the bottom line is that, and this is where I'm trying to bring the program today, is that Bill is empowering that patient.
Right.
So you've got an adversity here. This is how I'm going to inform you about it. These are the options that we got to look at. But this adversity you are now in charge of, and I'm helping you. It's not a, oh my God, get your will out, call the family and start dusting things off. We're going to beat this. That's what we need to do with this virus now. Okay, young people are not killed by this virus. I mean, there are rare episodes, and you can write those up all day long, okay? But the people that are killed, we need to empower them on how to get through their life and live it. Now, here's one of the things that's been irking me all along. We talk about social distancing, and it's one of those things that we're doing in our culture constantly. It's this little lie. It's not social distancing, it's anti-social distancing. Why don't we say it's anti-social distancing? Now, we are antisocial when we distance and we hide our face under masks. That's antisocial. So we're doing it. We don't know. We're trying to, not spread the virus, but it is antisocial. And there are consequences to being antisocial, right? The point being is that let's try to get back to normal. We live with the flu. People die from the flu every year. We live with cancer. We live with heart disease. We live with car wrecks. Okay? We're living with COVID. How do we live with COVID and not fear, not live in fear?
Second wave, round 2, second wave, going into the fall. Hospital rates.
One more time, doesn't seem seasonal. I think that the impacts are not going to be because of winter time. Our behavior already, and it used to be when you had 25 people in an elevator with the flu and one guy sneezed over here, everybody got it. We're now in the elevator and you're only in the 4 corners of the elevator. So those things that made the flu worse in the winter, where we piled everybody together, everybody shook hands, blew their nose, and then shook hands, or they would blow their nose, put their hands on the escalator bar at the airport. We don't do that now.
Sick?
Yeah, we don't do that
now.
now.
I want to say this. Yeah, and I don't want to identify any stores because everybody went through this. Nobody was exempt. When this first really started and we had all these emergency orders in place from governors shutting things down, that most of the retailers had somebody that was assigned to the front of the store, basically giving your buggy a bath before you went into the store.
Well,
so
they're still pretty much doing that.
No, wait a minute.
Well, go ahead.
Anyhow, so anyhow, they would have the buggy, and you didn't get it till they gave it a full bath, and they gave it to you. Okay. Twice in the last week, I've gone into 2 different stores, and there's nobody up front. And I said to a lady yesterday, I said, remember, it seems like it was just a couple months ago that somebody was up here giving these buggies a full bath. Now we could just take the risk to grab that buggy and go. So, that has relaxed, some things like that. Talked earlier, it's good to see some of the salad bars back and things like that.
Right.
So
I'm 80 years old. I go in the grocery store, and I'm fully aware of what you say. I go immediately to that Kleenex dispenser that's got those wet things in it, and I pull out 2. And I wipe down the bar myself.
I do too.
And I wear my mask. Now, when that study came out last week that says that the COVID virus can live on money for as long as 16 days, on paper money for 16 days, you'll notice that in the rapid checkout lines, they've all gone to electronic money only. Some big stores, are electronic payments only. I think that makes some sense. Because the kid that was right in front of you might have just got back from Panama City and the spring break, and be COVID virus positive, and you pick up his $1 bill. I don't think there's a very high chance you'd be caught with it, but I'm happy to use plastic money. Jane isn't. She thinks they're tracking us. But still, when you go in that grocery store, if they haven't given it a bath, it's your responsibility, particularly if you are a few pounds overweight and over 50, to grab that thing and wipe it off yourself. So that's what Ray's talking about, learning responsibly how to protect yourself, because you don't know who had it before you. And use your credit card rather than giving them a $1 bill and taking dollar bills back.
So when it comes to, we're approaching the holidays and Thanksgiving and so forth, and we have these, Thanksgiving is inside the house, and it's usually where you start seeing the pictures on social media of 4 generations: the great-great-granddaughter, the granddaughter, the mom, and the grandmother.
With a football in the background.
And then it's usually the number one time of the year where, if you live in a senior care facility, that the family goes and picks mom up and brings her home for dinner, or dad. How cautious this year? We got to come to terms, if we're at an age, diabetic, our immune system, we have to make some personal choices, knowing that about our health, what we go into.
Yeah, we need to, I think there's 2 directions from it. Those at risk need to be the ones that are responsible for their cautiousness. Right?
I want to ask you a question, because you're actually in the extended care business. Will extended care facilities allow their residents to go out for a 2 or 3 day weekend over Thanksgiving and then return next week? I would think the answer would be no.
Let me ask that. Right now, they can go out and visit a family member outside at a picnic table for a few hours at a time.
But they can't go for 3 days. No, I think they won't allow that. I believe that.
And I agree with that. I mean, they are still need to be in the highly protected.
Yes, I think they need to stay in the nursing home and have the family come there and bring them some turkey and eat it out on the yard.
The president said this week, I am a senior, whether you realize it or not. Maybe I'm not, but I am 74 years old. I'm a senior. Talk about his care. Is it remdesivir? Is that what is
Yeah.
We talked about the
We got two
cocktail.
things. He got the remdesivir and he got the antibody.
He got the antibody cocktail.
So this guy's come back as strong as he was 3 weeks ago.
No, he hasn't.
He hasn't? Okay.
No, first of all, we know that he has on his CT scan a infiltrate in one of his lungs. And you remember he was on oxygen, off oxygen, and back off on oxygen. We know that he was given the cocktail at that point. He will be having a series of CT scans done on his lungs for the next 3 months to document that scarring has cleared up. So it wasn't like he walked out of there without anything going on. He has something going on. Now, he's not expected to have any sort of relapse. But if you'll remember, for the last few months, I've been saying that at least 30 to 40% of the patients who get sick enough to be ill will have some ongoing trailing symptom, fatigue. They may not get their sense of smell or taste back for 3 or 4 months. If they had an infiltrate like he had, they will be short of breath on major exertion, so the boys should go, it's not going to happen to the teenagers playing football, but they'll have shortness of breath with exertion. They may have a cough that gets them when they're in certain positions. So he has had documented and published a abnormality on X-ray. May have cleared by now, I don't know, but just in our practice, when we see this, then usually 6 weeks later you repeat the CT. If it's gone, that's the end of it. If it's a little better, then you wait about 12 weeks and repeat it again. So the point is, he left the hospital. He is not infectious. He is able to perform his duties, but I wouldn't be a bit surprised if he couldn't run as fast or perform as much physical exercise today as he was able to do the week before he got sick.
But is he an example of how far we've come?
He's an example
absolutely.
of how
on the treatment?
He's the poster
That's
child.
what I'm saying. Is he?
He's the poster
What
child.
say
I did
you?
that last week.
No, he is, but Bill's hitting on a good point. Somewhere during my training, one of the things that surgeons started doing was getting people up and moving as quickly as possible after surgery. Prior to that, it was like, okay, you just stay in bed for a few weeks or whatever. You went in with appendix, you had your appendix out, and you may be in the hospital 3 weeks. Now, at the point where I was a student, it was UOOB, up out of bed. Okay? The surgeons wanted the nurses to get them up out of bed, get them moving.
Yeah, I know.
So, but we now know that the human body, if it's laying down, not doing anything for long periods of time, the body just starts eating those muscles. You just get weak as a kitten and things.
That's why they got weights on space stations.
Yeah. So we want people moving, and the illness, if it does nothing else, it can make you weak, and you lay around and your body deteriorates a little bit. And when you're 70 years old, it's hard getting that back. So it is a fight getting it back, and there's no getting around it. Here's a question I want to ask you, and I don't know the answer to this because I'm fishing for it here. The media once again had all their I keep using the word hair on fire thing going. All these people that got sick at that event, and they were certain it's from not wearing a mask. I don't know where they get their smarts from, but they were certain it was not from getting a mask. Now, of all those people that got sick, how many have died?
No reports on that. That's exactly right. I haven't heard anybody
How
die.
many were in the hospital?
They have gone, and you asked me that because I watch daily. I mean, they don't say Rose Garden event without saying super spreader.
Yeah.
And the super spreader event, and they put the list up, but they never say, Kaylee McElhenney Barron Trump, we found out Barron had no symptoms whatsoever, but did test. I think something you said weeks ago on this show resonated with me. There's a difference in being sick and a positive test.
That's what we said when I started.
Right, exactly. Both of you, I mean, we've talked about that for how long. There's a difference in being sick and a positive test. You're exactly right. On that list, we haven't had anybody die, and we hope nobody does, and even Chris Christie's out of the hospital. And I will tell you this, I was concerned when Christie got it because he's very
He's got
overweight.
everything, yeah.
And I was very
Listen.
concerned, but I guess he's out
Okay,
now.
before we wrap this up, I want to attack this thing about the testing because, number
Yes.
one, I promised to do it. I got asked about it. Let's grab up let's go through these graphics kind of quick here. The tests that are, the tests out there that are the most touted are these Abbott tests. They've got 2 of them. There's a new one. You got that first little box there? This rapid test here, go to the second one, to the next one. To do this test, somebody's got to put something up your nose. Okay?
Yeah, I know.
Now, they've got it to the point where you put it up your nose, and that's not going back down their throat, that's just going in the front of their nose. And what people don't really understand, show that next one. This one is an antibody test. There's so much difference between the antibody test and this is a rapid antibody test. Go to the next one.
That's the finger prick test.
Yeah, they stick your finger, see? And they put this little drop of blood on that little thing there. Now go to this last little box because this is what I want to try and show. You got that box up there? As I mentioned earlier in this show, when they do this, the federal government bought 750 million of this new Abbott test. And the Abbott test was released for use when it had only had 109 tests done. Now, I wouldn't spend that kind of money on something that had 109 tests done. The way that testing is done is the laboratory spikes a sample with a known amount of antigen. Now, this is not a PCR test. Remember, the PCR test goes for the genetic material. And then they see if they can detect it. Well, if they detect it 97% of the time, then they say it's 97% specific. Then the real world experience is what we're worried about. When Ray has a patient in his office with flu-like symptoms, a temperature and a cough, and he does the flu test to confirm it, it's this type of test. And if it comes back positive, Ray says, okay, I don't need to go do anything fancier. It has confirmed my clinical suspicion. I'm going to give you Tamiflu. Or if the guy's sick enough and it comes back negative, he gives him Tamiflu anyway. But it's a clinical judgment machine to make a clinical judgment and have a reasonable chance that the test has predictive value in a case. None of these tests have been approved for screening. They're only approved to be used in the first 6 days of a symptomatic patient when the load would be expected to be high. So now, taken out into the real world where New York University found 40% of these tests had false negatives and Cleveland Clinic found 15% false negatives, somewhere between those two numbers the right number is going to be. So when they were using these in the White House to test for positivity, and if you were negative, you went into the White House. That's why they had negative tested people at that event who were positive. And that's why it became a super spreader event. Are you with me?
Yes.
They tested negative on a test that ultimately has someplace between 15 and 40% false negatives. So they let somebody in that was in that group. Now, this little box right here, this is how, and I just want to make it, this is so complicated that we can't understand it. The calculation of a false positive rate is calculated by taking B divided by B plus D minus 1 to the true negativity power of 6 with the false positive predictive rate of A minus B plus. I mean, you can pull that down now. I mean, that's about as bad calculus and stuff in college as you could ever get. People like us aren't going to understand that mathematical statistic argument that has to be made way back at the level of Dr. Marlowe and those people to deliver something to Ray Tidman and his office is going to do some good. I'm very encouraged by the fact that Ipsum it has a test that will be in Ray's hands within a couple of weeks, that when he tests a patient now, it'll say COVID positive, COVID negative. It has a combination with a flu test, so it'll say he's got the flu and 20 other common viral illnesses. So that test not only will tell him if he's got any of 20 diseases, COVID one, flu one, and then arbovirus and everything else separate. Now, can you imagine what kind of tool that'll be in the hands of a clinician, where a guy's sick and blowing his nose? That's not a screening test. That's a predictive value test, a diagnostic test. And we got to keep remembering that when you have a test that's for diagnosis and you're messing around with it in a place that's not meant to be, it's like trying to unscrew a screw with a hammer. It's using the tool for the wrong purpose.
We have for the longest time, one political party has made claims that they have followed the science, social distancing.
That's the Green Party, right?
I'm trying to stay away from. But recently here we find out that some people around these candidates now are infected with COVID. So
Imagine that.
what I'm saying is, if we wear the mask everywhere and we do everything we possibly can that is recommended,
You can get sick.
you can still get COVID, correct?
Well, did you get any dollars at the grocery store?
No.
I mean, seriously, did you make change?
No, I don't make change.
Well, you see what I'm saying? You can't protect yourself from everything.
Exactly.
Here's what's common. If I'm somewhere with somebody I don't know, I'm going to wear the mask. If I'm going to go in the store, I'm going to clean that thing if they didn't clean it. And I'm going to use my credit card.
I have probably two things I know we got to close, and I brought this up last week, but it's being talked about again. We went to, many of us missed our summer concert series. Some of us like to go to the park, and when they have the jazz festival,
picking in the park,
the blues festival, and picking in the park, whatever it may be. We missed that. We're going into the fall. Trump has held, and I'm be candid here, he's holding rallies that people are making their own decision to go, 15 and 20,000 and 10,000 people at a shot, and I'm going to say the word ridiculous. And the other day, somebody came out with one of the networks and said, when he held the rally last month in Minnesota, it is now suspected, this is exactly how they put it out, it's now suspected that they have found, now 10,000 people there, 5 people that tested positive that may have been connected to that rally. That's exactly how the report came. It's ridiculous. I want to say that there's a lot of good doctors that are discussing this on TV. They are. There's some very good ones. But it's not a good portion of this ridiculous what some are hearing. And I hate to put the word like that to two doctors.
Whoa. Let's talk about statistics. I just said 1 out of 39 people in this county have had the virus.
Right.
You got 10,000 people out there from some other county. I mean, you don't have to be a mathematician to say if you only had 5 that were positive, that would be a miracle. There ought to be 300.
The counterfactual, okay? The economic shutdown, the economic injury that's happened to our culture is also going to kill people. We can't keep going down that street.
No, we can't.
Those people that are at risk need to start studying on this, and if a lot of them got this down, but those that haven't need to, they need to get more and more serious about it and learn more and more stuff. The rest of us got to get our jobs done and protect ourselves the best we can. But it is really down to, let's get back to life now. There is no sane person. I'm sorry. There are going to be some pictures shown in a few years of those governors and whoever that still had their heel on the markets and are killing these restaurants and killing these fitness centers and all that kind of stuff. They're killing those industries. And those
the owners, and the
their
workers.
and their families, and their workers. And that will create more illness and more death than anything they think they're helping from. And it's horrendous. That is not an okay treatment anymore, shutting down the economy.
Didn't the World Health Organization
said stop it.
even come
The
out
world
and say-
over. WHO said stop the economic shutdown.
Well, now,
Stop the shutdown.
interestingly enough, they said continue the economic shutdown in the afternoon, and then the next day before noon, they said in the economic shutdown. I mean, if that wasn't the funniest thing, I mean, Jane can tell you it's 18 hours apart when they made those two statements.
So, yeah, they came out and said the shutdown, and I think I would recommend that people research the other things that are happening where, yes, poverty causes death, depression, blocking people up. It's just there's so much disaster on the other end that this is causing, not just the illness of COVID.
Absolutely.
We're headed in the right direction. Vaccine,
I'm very proud. I'm very
clinicals,
happy.
everything's
Yeah.
headed in the right direction. We get to bouncing around with so much stuff. These Trump rallies, it's just what they are. These political rallies where people are going 15,000 at a time. Take your hand sanitizer and your mask and
Make an adult decision.
adult decision, okay?
Yeah, that's exactly what I say. And if you're 30-year-old, take your hand sanitizer, wear your mask to your, if you're in there with 5 or 6 people, like some of these college football games, everybody's complaining, but they've got it broken up where these 6 people all came together and they know each other and they live together, and then they're 10 feet apart before somebody else. I mean, this is outdoors.
I will tell you this, and I want to say this. I am attending, President Trump will be in Macon at 7 o'clock tonight, and I will be there. When I get the email back on what you can't bring in and can bring in, for those out there on the list, they will provide. They're just not the federal government making you do something. On the list, when you get the email, when you come to the gate, you'll be handed a mask, hand sanitizer, and I forget what else. But
Budweiser.
that's pretty good. We need to add that. But they give that to you. They're not just saying throw caution to the wind and everybody. So they're going to hand out hand sanitizer, one thing after another. So that
You need to make that on your part. You need to say that several times in other shows you do this
they
week.
give out the hand sanitizer.
Well, and to do this too, Brian, okay? This is one of my pet peeves. We talk about me teaching my elderly patients how to think like a hospital worker. Okay?
Right.
When you saw candidate Biden pull his mask down and
Cough in
into
his hand.
and then pull his mask back up, that is absolutely, it's laughable.
That's
Okay?
the worst thing you can possibly
somebody handing you a
do.
mask doesn't fix things if you're going to do stupid. Okay? Because he coughed into his hand with germs all over it, and then he's doing whatever, shaking hands or patting people on the back.
Well, is at least touching stuff.
I tell you what I want to work on for next week, and if you want to touch on it briefly right now, is the other thing with fall. And one of my biggest things is our kids, our health and welfare, and the education of our children, what we're doing to them. And high school football, we seem to be finding a balance. Every week there is a game canceled, but
2 games canceled the Mountains this weekend.
right, we're working through it. We are working through it. We're getting ready to go indoors. So let's think about that, because we're getting ready to go indoors to the
Basketball.
old high school basketball gym, where when those balls bounce and go through my brain on that court, but we're getting ready to go indoors in activities, and how should those be handled, and what we're looking at here in the near future.
It's going to be a bubble, and there's not going to be many people in the stands.
Okay. You think
I think he's right.
he's right? Final thought for the day. Sorry we bounced all over, but it's just really
Let
good.
the kids have their sports. What happened with the cross country team? Did you hear anything? I know the parents were pretty upset,
That,
as they should be.
yeah, they're upset. We'll leave it at yes, they're upset. Parents are they're upset.
You're depriving children of a chance to be excellent. and you're blaming an individual on the team for taking that away from them. It's wrong on all levels.
Right, and that poor kid that's positive he's going to
live their life with it.
Well, they could be bullied, you know.
Yeah.
I mean, that's just awful. I think being anonymous is really important in this situation. And how can you be anonymous in a small town when you got to go home and stay for 2 weeks and everybody else can go back to school? You're not anonymous. Now, you're pretty anonymous when you got a whole but anyway, I think that the kids should be allowed to play their sports. I think that as I've said many times, if the quarterback hurt his knee, they'd put another quarterback in there. If the quarterback's got the virus, what's Alabama going to do on Saturday? Their coach has got the virus. He's going to be at home with a bunch of headsets and television.
NCAA said no.
What?
Can't coach from home.
Well, he's not going to be on the sidelines anyway.
Can't coach from home is what they said. So we'll see what Nick Saban does. So we'll switch over.
I didn't realize they said he could. What did they say that yesterday?
Yesterday. Can't coach from home.
Is he going to cheat or something? Or?
Let's not go there.
Oh yeah.
Okay. Let's wrap this sucker up.
He's got a great staff. Okay, I want to say one thing. This community has got sun all weekend long, gorgeous weather all weekend long, and you are safe outdoors. Go play golf. Go over to the Merciers and pick apples. Take a hike in the mountains, and if you come in here where all these people from Florida are to buy your groceries, wear your mask, clean off your hand sanitizer, your thing with a sanitizer, and use a credit card instead of dollar bills.
Hey, folks, very encouraging news, and I would say some of the takeaway is proceed with caution. I mean, the reality is there's so much information now that we did not know in the past. How to prepare ourselves to go into areas that may be high risk or don't go in high risk. Our personal health issues, take those into account before we do certain things. We have information now to work with. I, for one, feel very good. We're all headed in the right direction, whether it's medication, hospitalization, the treatment we're getting there for these patients, a vaccine, so many things going in the right direction. So live your life. Don't let fear grip you. Make your doctor's appointment. We always say that because, look, I am one as concerned with these doctors that we've talked about in the past. In a couple years, we're going to have much bigger health crisis in our country and maybe around the world due to the results of how we handled this. So come on up this weekend. Thank you, North Georgia Cancer Research, affiliated with Northside Hospital, for this segment. You could share this segment with your family and friends. Go to FYNTV.com and look for Ask the Doc, and also our YouTube channel, FYNTV, Fetch Your News YouTube channel. Playlist Ask the Doc. Share this with their friends and send us a question. We're still focusing on COVID, but if you have something out there we haven't addressed and you hear something throughout the week, send it on our social media pages, FetchYourNews.com, FYNTV.com, Facebook, Twitter, whatever, Instagram, or send it to info, I-N-F-O, at FetchYourNews.com. Put in there, Ask the Doc. We're going to talk to the All-Star Political Panel right after this. Thank you, gentlemen. We always appreciate your time coming in and sharing with our friends at home. We're going to take a brief break. We'll be right back.